Organisations helping people with mental health issues in Manchester say many are having specialist help taken away without their consent because of failures in the system. Some patients aren't even aware of what's happening until they try and make an appointment.
Meanwhile, GPs say that seriously ill patients are facing long waits to then get back into the system. The mental health trust involved says decisions are made to benefit the individual. Our health correspondent Jill Dummigan has this exclusive report.
It's a weekly meal together, a chance for a chat and sometimes a helping hand. The people at this community group have spent years struggling with mental health issues.
You've got no interest in you've got no interest in your house and things that go on.
This woman has bipolar disorder. For a decade she was under the care of psychiatric services. Then she says a problem forced her to miss an appointment and she was told specialist care was ending and she'd be seeing her GP instead.
I was disgusted, felt let down. I've not just got my well-being to think of, I'm a carer for my children.
The transition from specialist to primary care is called stepping down, and it's happened to most people here.
They have nowhere to turn. A lot of people are being left without care plans, without any emergency plans to follow if anything was to go wrong, apart from to turn up at A&E.
National guidelines say the patient should be given a care plan and be involved in the decision. But this report about the service, published late last year, makes it plain that many people had no idea of what was going on. Here are some quotes. "I'm not sure if I'm discharged or not," says one person. Another, "The services just stopped." A third, "I was told it would happen. I've just been crossed off the books." The change in policy is also putting extra pressure on the city's GPs. This large practice in the centre has recently hired a mental health specialist to deal with the increase in demand.
It's about maybe trying to do things a little bit differently, how we can help those people in primary care, help them gain some more control over their lives and help them to navigate the care that they can receive if they need to go back into mental health services.
But most GPs don't have access to people like Laura, and even those here say they struggle to get patients back into specialist help if they relapse because services are so stretched.
People will say, well, we can't see them today. You have to wait 48 hours. How bad are they really? Well, we think they'll be all right, and wait. And so we as doctors have to manage their families' concerns. We can see, because we know the patient, that they've got much, much worse. And the mental health services in the hospital are trying to juggle.
No one from the Greater Manchester Mental Health Trust was available for interview today, but they sent us a statement saying that specialist mental health teams offer care for people suffering from a range of mental illnesses. When they respond, it's a positive for them to step down from those services and return to the care of their GP, and that step-down decisions are based in evidence and what is of most clinical benefit to the individual. Jill Dummigan, BBC North West Tonight, Manchester.